The structures of the skin include stratum corneum, stratum lucidum, stratum granulosum. Stratum corneum, stratum lucidum, stratum granulosum. Stratum corneum, stratum lucidum, stratum granulosum. Stratum corneum is a barrier to light, heat, water, chemicals, bacteria. Barrier to light, heat, water, chemicals, bacteria. It has 20 to 30 layers of flat, dead cells filled with keratin. 20 to 30 layers of flat, dead cells filled with keratin. Number 2, stratum lucidum. This is only present in the fingertips, palms of the hands and soles of the feet. It's only present in the fingertips, palms of the hands and soles of the feet. 3 to 5 layers of clear, flat, dead keratinocytes. 3 to 5 layers of clear, flat, dead keratinocytes. Third layer is stratum granulosum. Stratum granulosum. It's a transition layer between the deeper metabolic active strata and the more superficial strata. 3 to 5 layers of flat dying cells that show nuclear degradation. Stratum corneum, stratum lucidum, stratum granulosum. Now we have stratum spinosum and stratum basale. Stratum spinosum and stratum basale. Stratum spinosum. 8 to 10 cell layers held together by desmosomes, mostly keratinocytes. Function, strength and flexibility to the skin. And it contains Langerhans cells. Also contains stratum basale. In the dermis upper, we have papillary region, which contains areolar connective tissue, as well as accessory structures such as hair follicles, oil glands, and sweat glands. The function is it anchors the dermis to the epidermis. It also provides strength, extensibility, ability to stretch, extensibility, and elasticity. But before that, we didn't mention that the structure of the dermis is connective tissue. After the papillary region is the reticular region. That's the bottom 80% of the dermis. Has dense irregular connective tissue that contains interlacing collagen and elastic fibres. It also has adipose and hair follicles. Provides strength, extensibility and elasticity to skin. So that's the same, strength, extensibility and elasticity, but the papillary region, as well as that, anchors the dermis to the epidermis. What are the two regions of the dermis? Papillary region, reticular region. What are the functions? They are both strength, extensibility and elasticity. And papillary also has a function of anchoring dermis to epidermis. Papillary has areolar connective tissue, whereas reticular region has dense irregular. So that contains interlacing collagen and elastic fibres. What are the accessory structures of skin? Hons. Hair, oil, nails, sweat. Hons. So first let's look at hair. Hons. Present everywhere apart from palms, surfaces of digits, soles, and plantar surfaces of digits. The shaft is above the skin. The root penetrates the dermis. It has a sebaceous apocrine gland attached. It prevents heat loss, decreases sunburn, senses touch. Hons. So oil glands, produces sebum, moistens hair, inhibits growth of bacteria and fungi, waterproofs and softens the skin. So you could say that as WIM, waterproofs, inhibits growth of bacteria, moistens hair, WIM. Hons. Accessory structures, hons. Nails are tightly packed keratinized cells. That is the lunula. That is the cuticle. Lunula is white due to thickened stratum basale. The function is protection and cutaneous sensation. Sweat glands there's eccrine sweat glands and apocrine sweat glands. Eccrine sweat glands terminate at pores at the surface. They regulate body temperature. apocrine sweat glands, they are just in the pubis and areolae, and is smelly sweat. Ducts open into hair follicles. Other functions of skin. These are the functions of skin. Functions of skin. We could say BET, thermoregulation, excretion, and blood reservoir. So we'd start off with blood reservoir, excretion, thermoregulation. So that's the BET. And if we can put two letters together, so maybe we should put CT together. Bex. Pex. 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 So let's pex. Pex. Protection, pex. Extretion, cutaneous sensation, thermoregulation, synthesis of vitamin D. Protection, excretion, cutaneous sensations, thermoregulation, synthesis of vitamin D. Other functions. So we start off with PETs. Protection, protections against UV light. Langerhans cells alert immune system. Langerhans cells alert immune system. Excretion, 400 mils a day of water. Cutaneous sensations, touch, pressure, vibration, tickle, heat, cold and pain. Touch, pressure, vibration, tickle, heat, cold, pain. Touch, pressure, vibration, tickle, heat, cold, pain. Touch, pressure, vibration, tickle, heat, cold, pain. T. Thermoregulation. If it's too cold, then the hairs stand up. There's shivering and constriction of surface vessel. Blood flow to capillaries decreases. Too hot, sweat glands release. So too cold, the blood vessels increase and move further to the surface. No, that's not right. Blood flow to capillaries decreases if it's cold. If it's hot, blood flow to capillaries increases. Hairs lie flat, heat escapes, sweat secreted by sweat glands. When exercising, blood circulates to surface, and it avoids blood circulation, avoids surface of skin to retain heat. That's when exercising. In moderate exercise, more blood is brought to the surface. With extreme exercise, blood is diverted into muscles and body temperature rises. In moderate exercise, more blood is brought to the surface to help lower temperature. With extreme exercise, blood is diverted into muscles and body temperature rises. So pecs, that's T, so now we're up to S. And that is synthesis of vitamin D. Vitamin D is necessary to help calcium be absorbed in the GI tract. Vitamin D is necessary to help calcium, what? Be absorbed in the GI tract. The liver, enzymes in the liver and kidneys modify the activated molecule which receives the vitamin D on the surface of the skin to produce calcitrol, which is the most active form of vitamin D. And then we have medical terminology. Sagittal plane divides the body into left and right sides, and it's either mid-sagittal or parasagittal. Mid and para. The frontal plane divides the body into front and back portions. The transverse or horizontal plane divides the organ into upper and lower. The oblique, some combination of the other two planes. Abdominopelvic cavity. There's a superior abdominal and an inferior pelvic cavity in the abdominopelvic cavity. Viscera of the abdominal cavity include stomach, spleen, pancreas, liver, gallbladder, small intestine, and most of large. Viscera of the pelvic cavity include urinary bladder, large intestine, and female internal reproductive structures. There's an epigastric region, an umbilical region, and a hypogastric region. Epigastric, umbilical, hypogastric region. There's also a left hypochondriac, left lumbar, and left iliac region. Right hypochondriac, right lumbar, and right iliac region.